Hey, are you Steven?
Sí, sí, Steven.
Awesome, I'm Audrey. How are you doing today?
Hola, muy bien, mucho
Hey,
gusto.
perfect, mucho. If you want to have a seat right here in the chair, that'd be amazing.
Ok, sí, está bien.
Okay. So how are you doing today?
Very good, muy bueno.
Alright, perfect. So you're having a little bit of pain right here, right here?
Sí, el olor a muela.
Okay, way back there. Okay, now let me-
Pasa, me duele mucho acá.
How long have you had the pain?
Unos meses, few months.
Months, okay.
Sí. No me gusta el dentista.
Okay, you know, that's okay. You know, it's okay. We're very nice here, okay? And is the tooth, is it sensitive to any like cold or hot, like ice cream, coffee, things like that?
Okay. Sí, tengo sensitividad. Yeah.
To both hot and cold?
No, el frío.
Just the cold.
Sí.
Okay, perfect. Thank you for letting me know. Alright, so for a few months, do you know like how many months roughly? Like maybe like 3, 5?
Por 7 meses.
Okay. Sounds good. So for 7 months you've had pain. Thank you so much for letting me know. I'm gonna go ahead and grab my gloves and some other materials, okay? I'll be right back, okay? Just hang tight. Okay, I got what I needed. And before we begin anything today, do you happen to have any dental insurance?
Insurance,
It would be something that kind of pays for the appointment today.
okay, sí, dinero, no tengo.
Okay, well that's A-okay. Our clinic is very flexible, okay? We'll work ways around that, okay? Then I have another question for you. When's the last time you've been to the dental office?
1 year, un año.
Okay. And then, do you know when the last time you got a cleaning? Was that around the same time, about a year ago?
No, probably maybe 3 years.
3 years. Okay. And then that last appointment, was that for a filling, something like that? Another painful situation?
Sí, sí.
Okay, sounds good. So today we are going to be getting x-rays on your teeth just to make sure that we can kind of see everything that's going on.
No me gustan los X-rays.
You don't like x-rays?
No me gustan.
Okay. So we really need to get x-rays for your teeth today. It's really, really important. I know it kind of seems a little bit misleading and things like that, but we have radiations and radiographs that are as safe as they can possibly be. So we use the digital radiographs, and they transmit very little radiation to you, okay? And the great thing about radiations is it can see things that we can't see with the naked eye. We kind of need that, and that way we can see if there's any other problems. We don't want to try to fix your tooth and there's actually another problem instead that we should be focused on. Does that make sense?
Sí, está bien. Okay.
Okay, so we're going to do that today, okay? That way we can treat you properly.
Okay.
Okay. And then I'm going to show you our radiograph, okay? It's very, very cool. It's the newest of the news. So this is the one that we're going to be using right here. So as you can see, it's not turned on right now. So as you can see, it's very adjustable. I can move it and adjust it. And I'm just going to point it at your face like so. And then that way, and then the beam will come right through here, okay? It's just going to be like a flashlight, okay? So if there's no light, you're not going to feel anything. It's not going to be uncomfortable or anything like that. It'll be very easy for you. I'm going to start leaning you back, okay? Just while we're waiting for the doctor to come save up on time. Alright, I'm just going to get you lean back, okay? So we're going to get started with the procedure, okay? If you have any pains or any discomfort, just raise your left hand, okay?
Okay.
Okay, sounds good. We're going to get started. Alright, so we just got the radiographs back, so it does look like you do have a couple of cavities. The doctor just looked at it.
Okay.
So, not just right here, but you do have a couple of other places. What's your diet consist of? Do you have like lots of sugar, things like that?
Chacho, sí.
Oh my goodness.
He hecho Rica fiesta.
What is it called?
Rica fiesta.
Okay.
Cacho, los Carlos, estos son bien buenos.
Oh, okay. Well, hold on just a second. Do you eat this regularly, like every single day?
Every day.
Okay. Okay.
¿Tú quieres?
Oh no, I'm okay. Thank you so much. Maybe later. Thank you.
Later. Okay.
So those things, I know they taste really, really great, but they're actually really bad.
Bueno.
Yeah, they're really, really bad for your teeth, though. I hate to break it to you. I would try to do a little bit better with that. Okay, try to decrease it a little bit, not completely, but I know, it's hard, but just try to decrease it a little bit. Okay, it's a lot of sugar and stuff like that. Okay.
No more.
No más. I know. Okay.
But this yes. See?
No.
You? No.
Okay. I'll try it later. Okay.
Okay.
And then, do you floss or anything like that? Like, do you brush your teeth twice a day and floss?
Brush y floss.
You don't floss. Okay. Is it because it bleeds? Is that why you don't floss?
Me duele, it's hurt. I don't like it.
You don't.
Who likes flossing?
I like flossing.
Hey, you're weird.
All right. Well, anyways, flossing is really good for you. I know it can be a little discomforting at first with a little bit of bleeding and things like that.
Mm-hmm.
The part where it's bleeding, let me tell you a little secret. That's actually where you need to be flossing more.
No.
It's the truth. I don't hide it. You have a beautiful smile. You have a very handsome smile. We want to keep it. Yeah.
Gracias.
Do you have any questions with that? Okay, sounds good. I'm gonna go ahead and start getting a look at you. Okay.
Okay.
Okay, sounds good.
Okay.
Hi, my name is Audrey, and today in the dental office we saw Steven today. Steven is originally from Mexico, so he has a little bit of different mindsets on preventative care for your oral health. One of the examples is that Steven only goes to the dental office whenever he's experiencing intense pain. He doesn't go for cleaning, every 6 months. I spoke to Steven about this, and I educated him later, but he grew up in a culture where that's not normally taught or known. So with the appointment today, the doctor recommended that we get radiographs on Steven. He wasn't very fond of the idea. He seemed to believe that radiographs are very dangerous and harmful. So, of course, I explained to him that the clinic that we use follows ALARA, which would minimize the exposure to him. And we also use digital radiographs, which then again reduces the exposure to radiographs. I then explained that with the radiographs that we can see so much more than without. And then began to understand that radiographs are needed so we can provide with him the treatment that he needs. Steven doesn't go to the dentist for preventative care at all. He only goes when treatment is needed. So Steven came in today not for cleaning or anything like that. He came in because he had a very painful spot in his mouth from a tooth. Later we discovered that there was a carie there. I informed Steven that coming into the dental office to have more routine check cleanings will help minimize these painful experiences that he has. A lot of healthcare decisions that we make in America are very about the individual themselves, and that's it, especially once the person is over the age of 18. But in a more Mexican culture, it's not really the same. A lot of the decisions that the Mexican culture will be making is kind of involved with the family, even extended family. They would ask the family, for example, if they should get braces or a filling or how the procedure should be done, instead of just getting the procedure done themselves. This is seen more commonly with children, but it can be seen in young adults as well. Of course, we noticed that Steven has a language barrier. His primary language that he speaks is Spanish. My primary language is English. With that, Steven felt a little bit nervous to come into the dental clinic knowing that I speak English more than I speak Spanish. Steven can't talk to me as openly as he wants to, and he can't describe to me the pain and the concerns that he has just because of that language barrier. Once I began to show that I speak just a little bit of Spanish, he began to open up more and talk to me a little bit more. So having that language barrier also makes it very difficult for the Mexican culture in the dental clinic. Past experiences from dental care can also influence how the Mexican culture views dental offices. Steven's case, he had a lot of pain in his last visits to the dentist. That's what he remembers most. His parents taught him that the dentist isn't a good place to be. So he came in worried and nervous of this appointment instead of coming in open-minded. Steven also has a different viewpoint with the financial cost of the dental office. So Steven would have rather paid for getting a cavity fixed than just for getting, a dental cleaning. He would have seen that as being unneeded, unnecessary. which of course we find later that it is very much necessary. In Mexico, dental procedures cost 50% to 70% less than America. So with that, a lot of the residents in Mexico actually can just pay right out of pocket for dental procedures, rather here in America, where insurance is so much needed because it is so expensive. Stephen, like many in the Mexican culture, believe that bleeding gums from flossing is a bad thing, and they avoid flossing because of this. Of course, that's not true. In the article, National Trends in Dental Care Use, Dental Insurance Coverage, and Cost Barriers by the Health Policy Institute states that 30% of Mexican adults do not have coverage, and this is the largest ethnic group in the country to be uninsured. In another article, Oral Health-Related Cultural Benefits for 4 Ethnic Groups by Julia C. Barker says, this suggests that Mexican-American residents in various parts of the U.S. lack adequate knowledge about the role of fluoride in caries prevention, and lack knowledge about the connection between oral health and consumption of sweets and frequent snacking. As you can see, Stephen frequently has snacks and sweets. We are taught in America that even putting a child to bed with a bottle of milk is not good for their teeth. It's very interesting that the Mexican culture teaches the opposite, that teaching to put a child to bed with honey even dipped on a pacifier is okay, because that'll settle a child at night. We see later that the effects on the oral cavity is not good. Furthermore, Barker says, tooth loss is inevitable as one gets older. This is the Mexican culture belief, that no matter what you do for your teeth, that they will one day be lost. So eating sweets, sugars, candies, and avoiding dentists for cleanings is okay, because eventually they're going to be lost. So we already lost them? I don't speak a lot of Spanish. Do you speak a little bit of English? Okay, way back there. Okay, well, the molars. Okay, awesome. Do you speak some now?
I gotta show you. So we had a patient.
Okay, well, we're not going in my mouth, actually.
Would you happen to have dental insurance? Insurance for dental.
Hey. Okay. You better stop acting out.